The health record shows that a patient has been using long-acting oral opioids to manage severe, chronic back pain secondary to a tumor located along the lumbar spine. She has just had her appendix removed. Which outcome will assure the nurse that her pain interventions were effective? 1. The patient is discharged from the hospital on post-operative day 5. 2. The patient ambulates from the bed to the bathroom on the day after surgery. 3. Pain is controlled, and respirations are in patient's usual range. 4. Wound dressing remains dry and intact for 48 hours. Answer. 3. Pain is controlled and respirations are in patient's usual range. Rationale. Pain management is a priority for this patient. However, opioids may cause respiratory depression and increase the risk of atelectasis and pneumonia. Well-managed pain and clear breath sounds indicate that the plan of care has been effective. The date of discharge from the hospital is dependent on many variables and is not an effective evaluative tool for pain, especially because this patient has chronic pain that is unrelated to her surgery. The distance ambulated depends on the patient's presurgical condition. Although pain does affect ambulation, this is not the best criterion for determining the level of pain. The condition of the dressing does not reflect on the status of the patient's pain. Which of the following potential complications is most likely related to the surgical procedure rather than to the general anesthetic? 1. Aspiration of gastric contents. 2. Cardiovascular compromise. 3. Fluid and electrolyte imbalance. 4. Respiratory depression. Answer. 3. Fluid and electrolyte imbalance. Rationale. Most surgical patients are at risk for fluid and electrolyte imbalance. This may result from blood loss, compromised renal function, the overall health of the patient, or maintaining the NPO status. Aspiration of gastric contents, cardiovascular compromise, and respiratory depression are potential complications of anesthesia. Which member of the intraoperative team sets up the sterile field, prepares the surgical instruments, assists with the sterile draping of the patient, anticipates and responds to the surgeon's needs, and maintains the integrity of the sterile field? 1. Scrub nurse. 2. Registered nurse first assistant. 3. Certified registered nurse anesthetist. 4. Circulating nurse. Answer. 1. Scrub nurse. Rationale. The registered nurse first assistant, RNFA, is an RN who serves as an assistant to the surgeon. The RNFA works with the surgeon to perform the surgical procedure. A certified registered nurse anesthetist, CRNA, may administer anesthesia and is part of the clean team. The circulating nurse is also part of the clean team and is an RN who utilizes the nursing process to coordinate all activities in the operating room. The nurse is completing a preoperative patient assessment. Which finding indicates the greatest risk for the development of a postoperative complication? A. The patient has early-stage Alzheimer's. B. The patient is 60 years old. C. The patient's blood pressure is 130/80ths of a millimeter of mercury. D. The patient does not understand the surgery. Correct answer. A. The patient has early-stage Alzheimer's. Rationale. The surgical experience may exacerbate any type of dementia, even in the early stages. A patient with Alzheimer's may not be able to comprehend written or oral directions related to care. In cases of major surgery, the patient with dementia may pull at dressing, drains, and IV lines and be at increased risk for falls. An elderly woman fell at home and fractured her hip. After being admitted to the hospital, the nurse knows that the patient is to be stabilized prior to having surgery. This surgery would be classified as A. Urgent B. Elective C. Emergency D. Palliative. Correct answer. A. Urgent rationale. This patient will most likely have her surgery within the next 48 hours. It must be done to restore joint function. The nurse knows that the most important reason for controlling postoperative nausea, vomiting in the POCU is A. To prevent potential airway issues B. To prevent the patient from becoming dehydrated C. To prevent the surgical dressing from becoming soiled D. To prevent the patient from becoming upset. Correct answer. A. To prevent potential airway issues rationale. The priority nursing intervention for the nurse in POCU is airway management. Controlling nausea and/or vomiting will prevent aspiration and ensure a patent airway. The nurse is performing irrigation of the nasogastric tube for a patient who had abdominal surgery and meets resistance when trying to instill the irritant. The nurse should 1. Use extra force to push the obstruction through the tube. 2. Remove the tape from the patient's nose and adjust the placement of the tube. 3. Have the patient turn to the left side to change the position of the tube. 4. Attempt to flush the tube via the airport. Answer. 3. Have the patient turn to the left side to change the position of the tube. Rationale. Patients having abdominal surgery are at high risk of abdominal distension and will return from surgery with a nasogastric tube in place for gastric decompression. Management of nasogastric tubing includes irrigation with 30 ml to 50 ml of saline. The irritant should be instilled slowly in the ing tube. If resistance is met when you irrigate, have the patient turn to the left side. Turning to one side changes the position of the distal tip of the ing tube. Do not force the solution. Do not instill fluid into the air vent. Manually adjusting the placement of the ing tube may cause accidental installation of irritant into the airway. An 83-year-old patient had surgery to repair a hip fracture and has not yet ambulated postoperatively. Based on this information, the nurse identifies the priority collaborative problem for the patient as 1. Fluid and electrolyte imbalance. 2. Impaired surgical wound healing. 3. Thromboembolism. 4. Hypovolemia. Answer. 3. Thromboembolism. Rationale. Older adults are at greatest risk for complications during surgical procedures because they have less physiological reserve and often have comorbid conditions. Thromboembolism results from increased coagulability and venous stasis due to immobility during and after surgery, and puts patients at risk for life-threatening pulmonary embolus. Nursing care should focus on preventing thrombophlebitis by encouraging and assisting with leg exercises and ambulation, applying antiembolism stockings or sequential compression devices, and maintaining adequate hydration. The nurse asks a preoperative patient to sign the operative permit as directed in the healthcare provider's orders. The patient says, "I do not really understand why I need surgery." The nurse should 1. Communicate the patient concerns to the circulating nurse upon arrival to the operating room. 2. Explain what the planned surgical procedure is for and then have the patient sign the consent form. 3. Have the patient sign the form anyway and then ask the healthcare provider to visit the patient. 4. Notify the healthcare provider that the informed consent process is not complete and delay sending the patient to the operating suite. Answer. 4. Notify the healthcare provider that the informed consent process is not complete and delay sending the patient to the operating suite. Rationale. Professional standards and law require the surgeon to obtain the patient's informed consent. The signed informed consent verifies that the patient and the surgeon have discussed the surgery and the patient understood it and was not pressured into having the surgery. The surgeon is responsible for giving the patient necessary information. As a patient advocate, the nurse is responsible for assuring that the surgeon explained the procedure and that the patient understood the information. If you have any questions about the patient's understanding or ability to understand, notify the physician and delay sending the patient to surgery. The nurse is teaching a patient how to prevent surgical site infections in the postoperative period. She should focus her teaching on 1. Care for the surgical dressing. 2. Hand washing. 3. Medications used to control pain. 4. The need to complete all ordered antibiotics after surgery. Answer. 2. Hand washing. Rationale. An important aspect of perioperative nursing is to prevent complications of surgery. Hand hygiene is an important component of prevention. Family and friends should wash their hands before and after they visit the patient. Anyone who examines the patient or checks their incision should wash their hands. Patients should be instructed to wash their hands before and after caring for their incision or surgical dressing. A patient is having surgery to remove an inflamed appendix. Which of the following describes this type of surgery by purpose? 1. Ablative. 2. Diagnostic. 3. Palliative. 4. Reconstructive. Answer. 1. Ablative. Rationale. Ablative surgery involves removal of a diseased body part, in this case, the appendix. Diagnostic surgery is undertaken to confirm or negate a diagnosis, e.g., a biopsy or a fine needle aspiration. In this situation, the diagnosis was already made and the surgery is being done to treat the condition. Palliative surgery is done to alleviate discomfort or other disease symptoms without producing a cure, e.g., nerve root destruction. In this situation, pain will be relieved, but a cure will also be effected. Reconstructive surgery is performed to restore function, e.g., repair of a torn ligament. This surgery removes the appendix rather than repairing it. Which phase begins when the patient leaves the post-anesthesia care unit, PACU, and ends when the patient has recovered from the surgery? 1. Postoperative. 2. Intraoperative. 3. Preoperative. 4. Perioperative. Answer. 1. Postoperative. Rationale. The postoperative phase begins when the patient has recovered from anesthesia and ends when the patient has recovered from surgery. The preoperative phase begins with the client's decision to have surgery and ends when the client enters the operating room. The intraoperative phase begins when the client enters the surgical suite and ends with discharge to the post-anesthesia care unit. The perioperative period includes the preoperative, intraoperative, and postoperative phases. The patient tells the nurse, "I'm so nervous. I want to be knocked out for the surgery so that I don't know what is going on." When the nurse communicates with the surgeon and anesthetist, she tells them that the patient desires which type of anesthesia. 1. Conscious sedation. 2. General anesthesia. 3. Local anesthesia. 4. Regional anesthesia. Answer. 2. General anesthesia rationale. General anesthesia produces rapid unconsciousness and loss of sensation. During conscious sedation, the client feels sleepy but is easily aroused by touch or speech. Regional anesthesia interrupts nerve impulses to and from the affected area, but the patient remains alert. Local anesthesia produces loss of pain sensation at the desired site and is typically used for minor procedures. The client remains alert during local anesthesia. A patient had a hiatal hernia repair earlier today and is now in the post-anesthesia care unit, PACU. The family asks the nurse why the patient is in the PACU rather than back in his room on the post-surgical unit. The nurse should inform the family that 1. Patients who have had surgical complications are observed in the PACU until they are stable enough to return to the floor. 2. Patients recover from the effects of anesthesia in the PACU and then return to the post-surgical unit for further care. 3. The PACU is a holding area for patients awaiting a surgical unit bed or awaiting adequate staff to provide care on the post-surgical unit. 4. The nurse will ask the surgeon explain to them why the patient is not on the post-surgical unit, as is the usual procedure. Answer. 2. Patients recover from the effects of anesthesia in the PACU and then return to the post-surgical unit for further care. Rationale. A client remains in the PACU until he has recovered from the effects of anesthesia. In the PACU, the client is assessed every 5 to 15 minutes in order to quickly identify surgical or anesthesia-related problems. Most surgical units routinely admit patients to the PACU for a period of observation. Admission to the PACU does not indicate surgical complications nor imply that a holding area is required. There is no reason the surgeon would need to explain this to the family, as the nurse could do it. It is not usual procedure for a patient to be transferred directly from surgery to the post-surgical unit. A patient is to have a sequential compression device, SCD, applied on the post-operative unit. The patient is wearing knee-high elastic, anti-embolism, stockings. When applying the SCD, what should the nurse do? 1. Remove the anti-embolism stockings and not replace them. 2. Replace the knee-high stockings with thigh-high stockings. 3. Notify the surgeon that the patient is wearing anti-embolism stockings. 4. Apply the SCD over the knee-high anti-embolism stockings. Answer. 4. Apply the SCD over the knee-high anti-embolism stockings. Rationale. If elastic stockings have been ordered with the sequential compression device, leave them in place. If the patient is not yet wearing them, obtain them and put them on the patient. Knee-high stockings do not need to be replaced with thigh-high stockings. Some research has shown knee-high stockings to be equally effective. There is no need to notify the surgeon, as patients commonly return from surgery wearing anti-embolism stockings as prescribed. The focus of nursing activities in the preoperative phase is to 1. Admit the patient to the surgical suite. 2. Prepare the patient mentally and physically for surgery. 3. Set up the sterile field in the operating room. 4. Perform the primary surgical scrub to the surgical site. Answer. 2. Prepare the patient mentally and physically for surgery. Rationale. The nursing focus in the preoperative phase is to prepare the patient mentally and physically for surgery. The patient is in the intraoperative phase when admitted to the surgical suite. The sterile field and the surgical scrub would be performed in the surgery suite during the intraoperative phase. A patient is scheduled for abdominal surgery tomorrow. While gathering preoperative data, the nurse learns that the patient takes the following medications daily: an anticoagulant, a multivitamin, and vitamin E 1500 IU. The patient reports that he stopped taking the anticoagulant 4 days ago as instructed by the surgeon. He has continued to take the multivitamin and vitamin E. Based on the information given, the nurse telephones the surgeon because she 1. Needs an order to restart the anticoagulant. 2. Is concerned about continued use of the multivitamin. 3. Is concerned about the vitamin E dosage. 4. Thinks the surgery should be delayed until further notice. Answer. 3. Is concerned about the vitamin E dosage. Rationale. Both prescribed and over-the-counter medications may increase surgical risk. Many herbs can cause potassium loss and increase the risk for cardiac arrhythmias. High doses of vitamin E may increase the risk for bleeding. This patient's use of 1500 IU of vitamin E daily exceeds the recommended dosage, so the nurse should inform the surgeon of the vitamin E intake. Generally, the surgeon or anesthesiologist instructs patients to continue or discontinue taking their prescribed medicines. However, it is important to assess use of supplements and over-the-counter medicines. The surgeon would determine if the surgery should be delayed. A patient is admitted for hip surgery. The patient usually takes the following medications daily: an anticoagulant, a multivitamin, and vitamin E 1500 IU. He stopped taking his anticoagulant 4 days ago as instructed by his surgeon, but has continued to take the multivitamin and vitamin E. An important collaborative problem or nursing diagnosis for this patient is which of the following? 1. Potential complication. Anemia. 2. Risk for infection related to inadequate anticoagulant dosage. 3. Risk for noncompliance related to inability to follow instructions. 4. Potential complication. Increased bleeding. Answer. 4. Potential complication. Increased bleeding. Rationale. The patient is at an increased risk for bleeding due to his intake of vitamin E. He may be at risk for anemia if he experiences a large blood loss in surgery. However, this problem is not appropriate before he experiences the blood loss. This patient does not have a higher than average risk for infection because he is not having surgery involving a contaminated system, e.g., the gastrointestinal system. There is no evidence to suggest that this is noncompliant, simply because he stopped taking his anticoagulant as ordered. A patient is admitted from a local skilled nursing facility to the outpatient surgery center for surgical debridement of a stage 4 sacral pressure ulcer. The perioperative nurse discovers that the patient does not have a signed consent form for the surgery on the chart or in the surgery center. The patient says that she has not talked to the surgeon and that she has many questions regarding her surgery. When informed of this, the surgeon tells the nurse to have the patient sign the informed consent form, and he will review it prior to the surgery. What should the nurse do? 1. Follow the surgeon's orders and ask the patient to sign the surgical consent form. 2. Inform the surgeon that she will have the patient sign after he discusses the surgery with the patient. 3. Ensure that the signed surgical consent is witnessed by 2 nurses, because the surgeon is not available. 4. Cancel the surgery and transfer the patient back to the long-term care facility. Answer. 2. Inform the surgeon that she will have the patient sign after he discusses the surgery with the patient. Rationale. Informed surgical consent requires that the surgeon present information about the surgery to the patient, that the patient understands the information and agrees to the surgery, and that the patient has not been coerced to give consent. As a patient advocate, the nurse should verify with the patient that the surgeon has explained the procedure and answered all her questions. The surgeon is responsible for giving the patient the necessary information and determining the patient's competence to make an informed decision about the surgery. If the patient has further questions, the nurse should notify the surgeon and delay sending the patient to surgery until an informed consent is obtained. Identify the type of surgery a terminally ill patient will undergo if the purpose is removal of tissue to relieve pain. 1. Procurement. 2. Ablative. 3. Palliative. 4. Diagnostic. Answer. 3. Palliative. Rationale. Palliative surgery alleviates discomfort or other disease symptoms without producing a cure. Procurement surgery occurs when an organ or tissue is harvested for transplantation into another. Ablative surgery involves removal of a body part. Diagnostic surgery confirms or negates a diagnosis. A 2-year-old child is scheduled for a tonsillectomy. When determining the plan of care, the nurse should 1. Include the parents or caregivers in the plan of care. 2. Explain to the child that she will have a sore throat after surgery. 3. Tell the child that she can have her favorite foods for the first 24 hours after surgery. 4. Prepare the child for discharge from the hospital as soon as she is alert. Answer. 1. Include the parents or caregivers in the plan of care. Rationale. It is developmentally normal for toddlers to experience anxiety with separation from parents or caregivers. Be sure to include these people in the plan of care. Developmentally, a 2-year-old lives in the here and now and wouldn't grasp an intangible concept, such as pain, in the future. The toddler would take liquids and soft foods within the first 24 hours when her throat is sore during swallowing. She should not eat foods that are rough and crunchy because they may scratch her throat and cause bleeding. After a tonsillectomy, the child will need to be monitored for bleeding and stable vital signs. Therefore, she will not be discharged as soon as she is alert. The nurse is caring for a male patient who will soon have open heart surgery. The patient's chest is covered with thick hair, so the surgical technician comes in to shave the patient's skin near the operative site. Which action by the technician requires intervention by the nurse to correct the technique? A. A straight safety razor and antibiotic foam is used. B. Disposable electric trimmers are used to trim the hair. C. Antibacterial soap is used prior to hair removal. D. Only the hair directly around the surgical site is removed. Answer. A. A straight safety razor and antibiotic foam is used. Rationale. Disposable electric trimmers should be used to remove excess hair from operative sites. Antibacterial soap is commonly used to clean the skin before surgical procedures. Only the hair around the surgical site is removed. A straight razor should never be used because small nicks in the skin can occur, increasing infection risk. Which of the following is the most appropriate nursing goal for a 2-year-old who is to have a tonsillectomy? 1. Separation anxiety will be minimal. 2. The child will verbalize understanding of expected pain. 3. The child will tolerate a normal diet 24 hours after surgery. 4. The parent will indicate readiness to assume the child's care. Answer. 1. Separation anxiety will be minimal. Rationale. The only concrete information in this question is that the child is 2 years old. Therefore, the only problem the nurse can reasonably predict from this would be developmental in nature. It is developmentally normal for toddlers to experience anxiety with separation from parents or caregivers. Minimizing anxiety by involving the parents or caregivers would be the appropriate goal for separation anxiety. A 2-year-old child would not be expected to verbalize understanding of expected pain. The toddler would take liquids and soft foods within the first 24 hours when her throat is sore during swallowing. She should not eat foods that are rough and crunchy because they may scratch her throat and cause bleeding. Nurses should encourage parental involvement, but parents should not be expected to assume the child's care. The nurse is caring for a patient who will be having surgery. The patient has just signed the consent form for the operation. What does the patient's signature indicate? A. The patient agrees with the doctor's diagnosis. B. The patient gives permission for the surgery to be performed. C. The patient has agreed to pay for any costs not covered by insurance. D. The patient has been told of all the available treatment options. Answer. B. The patient gives permission for the surgery to be performed. Rationale. The patient's signature on the consent form indicates that the patient gives permission for the surgery to be performed. It does not indicate that the patient agrees with the physician's diagnosis, agrees to pay for costs not covered by insurance, or has been informed of all the possible treatment options. Which action by the nurse best demonstrates accountability in the operating room? A. Applying warm blankets when the patient reports feeling chilly. B. Holding the patient's hand to allay anxiety before anesthesia is administered. C. Double-checking that the surgical site is clearly marked and visible after draping. D. Using calming speech with a reassuring tone of voice when speaking with the patient. Answer. C. Double-checking that the surgical site is clearly marked and visible after draping. Rationale. Accountability is accomplished by ensuring that proper precautions are taken to prevent errors from happening. The nurse can prevent wrong site surgery by making sure that the surgical site is clearly marked and visible after the draping is completed. The surgeon could inadvertently operate on the incorrect site if the markings are covered by the surgical drapes. The other actions of the nurse are appropriate but do not demonstrate accountability and error prevention. The nurse is caring for a patient who has a family history of reactions to general anesthesia. Which medication will the anesthesiologist have ready as a precautionary measure before the patient's surgery is started? A. Protamine sulfate. B. Dantrolene sodium, Dantrium. C. Activated charcoal with sorbitol. D. Folinic acid, leucovorin. Answer. Dantrolene sodium, Dantrium. Rationale. Malignant hyperthermia is a dangerous anesthesia reaction caused by a genetic defect that may be passed down via family history. Knowing this, the anesthesiologist should have Dantrium ready as a precaution because it is a mainstay of treatment for malignant hyperthermia. The nurse is caring for a patient who has just been brought to the postoperative unit following major surgery. The patient has many tubes and monitors in place. Which will the nurse assess first? A. The patient's intravenous lines. B. The patient's urinary catheter. C. The patient's nasogastric tube. D. The patient's endotracheal tube. Answer. D. The patient's endotracheal tube. Rationale. Airway maintenance and protection is the highest priority for this patient. so the nurse should assess the endotracheal tube first to ensure that it is patent and positioned correctly. The other tubes may be assessed afterward. The nurse is caring for a patient who underwent abdominal surgery the previous day. Which assessment findings indicate to the nurse that the patient may be experiencing serious internal bleeding? Select all that apply. A. The patient's urinary output increased to 40 milliliters per hour. B. The patient's pulse has risen from 76 to 112 beats per minute. C. The patient states that his abdominal pain is worse than yesterday. D. The patient complains of generalized itching. E. The patient's hematocrit dropped from 14.6 to 11.0 grams per deciliter F. The patient has not been able to have a bowel movement since before surgery. Answer. B. The patient's pulse has risen from 76 to 112 beats per minute. C. The patient states that his abdominal pain is worse than yesterday. E. The patient's hematocrit dropped from 14.6 to 11.0 grams per deciliter. Rationale. Signs of internal bleeding include tachycardia, increased abdominal pain, and a drop in hematocrit, hemoglobin. Urinary output would decrease with internal bleeding because the kidneys work to conserve fluids. Itching and constipation are not signs of internal bleeding. The nurse is caring for a patient who is recovering from bowel resection surgery. Which assessment findings indicate to the nurse that the patient no longer needs to remain NPO and may progress to oral intake of food and fluids? Select all that apply. A. The patient passed flatus while ambulating this morning. B. The patient's abdomen is soft with active bowel sounds X4 quadrants. C. The patient denies nausea or vomiting and states that he feels hungry. D. The patient's abdominal incision is clean, dry, and intact with staples. E. The patient ambulated in the hallway with a slow, steady gait. F. The patient's urinary catheter is patent with clear, yellow urine. Answer. A. The patient passed flatus while ambulating this morning. B. The patient's abdomen is soft with active bowel sounds X4 quadrants. C. The patient denies nausea or vomiting and states that he feels hungry. Rationale. The patient may indicate readiness for oral intake when passing flatus and relating feelings of hunger. The absence of nausea and vomiting along with active bowel sounds in a soft abdomen also indicate that the patient's GI tract is ready for oral feedings. Which of the following patients would benefit from preoperative teaching about splinting of incisions to minimize discomfort? Select all that apply. A. Patient having coronary bypass graft surgery. B. Patient having open breast biopsy. C. Patient having total hip replacement surgery. D. Patient having lumbar spine decompression surgery. E. Patient having surgery to repair retinal detachment. F. Patient having total abdominal hysterectomy. Answer. A. Patient having coronary bypass graft surgery. F. Patient having total abdominal hysterectomy. Rationale. Postoperative splinting is done by supporting the abdominal and chest muscles to minimize the pain of coughing and deep breathing after surgery. Patients who have just had heart or abdominal surgery will benefit from splinting. The other surgical procedures do not affect the chest or abdomen, and these patients would not benefit from teaching about splinting. The nurse is working with a nursing assistant to care for several postoperative patients. Which interventions can the nurse delegate to the assistant for completion? Select all that apply. A. Assess patient's comfort levels and need for pain medication. B. Empty urinary catheter bags and record urine output. C. Teach patients how to use incentive spirometers hourly. D. Provide ice chips and juice to patients who are no longer NPO. E. Monitor incisions for signs of infection. F. Applying TED hose and assisting with oral care. Answer. B. Empty urinary catheter bags and record urine output. D. Provide ice chips and juice to patients who are no longer NPO. F. Applying TED hose and assisting with oral care. Rationale. Basic patient care tasks that do not require assessment or critical thinking may be assigned to the nursing assistant for completion. These include emptying drainage bags, providing ice chips to patients who are allowed oral intake, and applying TED hose. Teaching, monitoring, and assessing patients are done by the nurse. The nurse will be caring for a patient who has just arrived on the medical surgical unit following surgical repair of his fractured right ankle. Which is the priority action of the nurse when the patient arrives on the unit? A. Instruct the patient how to call for assistance using the call light. B. Assess the color and warmth of the toes on the patient's right foot. C. Determine when the patient's next pain medication is due. D. Check pulse oximetry and obtain a full set of vital signs. Answer. D. Check pulse oximetry and obtain a full set of vital signs. Rationale. Checking pulse oximetry and vital signs is the priority action when the patient first arrives on the medical surgical unit from the postoperative area. The other actions can wait until the vital signs have been obtained. The nurse is obtaining preoperative information for a patient who will be having emergency surgery shortly for a ruptured appendix. Which information is crucial for the nurse to assess? Select all that apply. A. All medications that the patient is taking. B. Use of tobacco, alcohol, or recreational drugs. C. Allergies to medications, foods, or other substances. D. Date of last tetanus shot and flu vaccination. E. Insurance coverage and pre-authorization requirements. F. Possibility of pregnancy. Answer. A. All medications that the patient is taking. B. Use of tobacco, alcohol, or recreational drugs. C. Allergies to medications, foods, or other substances. F. Possibility of pregnancy. Rationale. Priority assessment must be completed prior to emergency surgery, including use of medications, alcohol, tobacco, or recreational drugs because these may interact with anesthesia medications. Allergies must be identified to prevent reactions in the operating room. Special precautions may be taken if the patient is pregnant, so this must also be determined preoperatively. Asking the patient about vaccinations or insurance coverage is not a priority prior to surgery. The nurse is assigned to care for several patients on the surgical unit. Which patient need will the nurse address first? A. A patient who is waiting for discharge teaching before going home. B. A patient who needs to be ambulated for the first time postoperatively. C. A patient who has not voided since the catheter was removed 8 hours ago. D. A patient who requires a daily dressing change to the surgical incision. Answer. C. A patient who has not voided since the catheter was removed 8 hours ago. Rationale. Urinary retention is common after removal of urinary catheters and must be addressed promptly. The nurse should address the patient with urinary retention first because it is the highest priority. The other patients may wait until later. The nurse is caring for a postoperative patient who has a history of COPD. What is the priority nursing diagnosis for this patient? A. Ineffective airway clearance. B. Readiness for enhanced knowledge. C. Risk for delayed surgical recovery. D. Activity intolerance. Answer. A. Ineffective airway clearance. Rationale. Ineffective airway clearance is the priority diagnosis for the COPD patient undergoing surgery because the patient is at high risk for bronchoconstriction, increased mucus, and ineffective cough, which may easily become worse after the patient has received general anesthesia. The other nursing diagnoses are applicable to the patient but are not as high priority. The nurse is caring for a patient who requires emergency surgery for injuries sustained in a motor vehicle accident. The patient was on his way back to work after having lunch with colleagues when the accident happened. What is the highest priority nursing diagnosis for this patient? A. Risk for imbalanced body temperature. B. Risk for aspiration. C. Risk for perioperative positioning injury. D. Risk for delayed surgical recovery. Answer. B. Risk for aspiration. Rationale. Risk for aspiration is the highest priority because the patient has not been NPO and his stomach is filled with food after lunching with his colleagues. The patient may easily aspirate stomach contents into the airway when general anesthesia is administered, so precautions must be taken to prevent this from happening. The other nursing diagnoses certainly apply but are not as important as risk for aspiration. The nurse is caring for a patient who is headed to the operating room for abdominal surgery. Which goal is appropriate for the nursing diagnosis risk for perioperative positioning injury? A. Patient will deny numbness or tingling in extremities after surgical procedure. B. Patient will maintain urine output of at least 30 milliliters per hour during and after surgery. C. Patient will maintain elastic skin turgor as well as moist tongue and mucous membranes. D. Patient will have no emesis and deny nausea following arousal from general anesthesia. Answer. A. Patient will deny numbness or tingling in extremities after surgical procedure. Rationale. Numbness and tingling of extremities may be indicative of injury following improper positioning for surgery. The other goals do not relate to positioning injury but relate to nursing diagnoses of fluid balance and nausea. The nurse is caring for a patient who is recovering from chest surgery. Which action by the patient indicates that additional teaching is needed about how to use the ordered incentive spirometer correctly? A. The patient breathes into the spirometer so that the marker rises slowly. B. The patient uses the spirometer at least 10 times every hour while awake. C. The patient seals his lips tightly around the spirometer mouthpiece. D. The patient rests for 5 to 10 seconds after each time the spirometer is used. Answer. A. The patient breathes into the spirometer so that the marker rises slowly. Rationale. The patient must take in a deep breath while holding the spirometer to the mouth so that the device can indicate how much air is being inhaled into the lungs. The patient should use the spirometer at least 10 times every hour while awake, Seal the lips closely around the mouthpiece and rest for a few seconds between breaths. The nurse is caring for a post-operative patient who is recovering from abdominal surgery. The nurse notes that the patient's breath sounds are clear but diminished, shallow, and slightly labored. The patient's pulse oximetry is 96% on room air. What is the priority action of the nurse? A. Administer a dose of the prescribed pain medication. B. Administer 2 L of oxygen via nasal cannula. C. Obtain an order from the physician for a chest X-ray. D. Ensure that the patient is using the spirometer 10 times every hour. Answer. D. Ensure that the patient is using the spirometer 10 times every hour. Rationale. The assessment findings indicate that the patient most likely has atelectasis. So the nurse should ensure that the patient is using the incentive spirometer 10 times every hour to facilitate expansion and reinflation of alveoli. Administering prescribed pain medication is not the priority and may further suppress the patient's respiratory drive. The patient's pulse oximetry is 96% on room air, so supplemental oxygen is not needed. A chest X-ray may be ordered if the patient's condition worsens or does not improve with regular spirometer use. The nurse is caring for a preoperative patient who has just received sedation prior to general anesthesia in the OR. What is the priority action of the nurse? A. Check to make sure that the consent form was signed. B. Turn off the lights and provide a quiet environment. C. Raise the side rails on the patient's stretcher. D. Indicate the surgical site with an indelible marker. Answer. C. Raise the side rails on the patient's stretcher. Rationale. Safety of the preoperative patient is a priority after sedation has been administered. Raising the side rails of the stretcher will help prevent the patient from falling. Turning off the lights is nice but is not a priority. Marking the surgical site and signing the consent form must be performed prior to administration of sedation. After general anesthesia is administered, the patient is carefully placed in the prone position. What is the primary consideration of the nursing staff as the patient is positioned? A. Making sure that the patient's endotracheal tube does not become kinked. B. Ensuring that the patient's head is positioned to prevent cervical nerve injury. C. Carefully taping the patient's eyes shut to avoid corneal abrasions. D. Patting the operating table carefully and keeping linens free of wrinkles. Answer. A. Making sure that the patient's endotracheal tube does not become kinked. Rationale. Ensuring that the patient's respiratory status is not compromised is the priority of all staff during repositioning after general anesthesia has been administered. Positioning and protection of eyes is important but less than protection of the endotracheal tube patency. The nurse is caring for a postoperative patient who is very sleepy following general anesthesia and administration of pain medication. The nurse notes that the patient is making snoring sounds and his pulse oximetry has dropped to 88%. What is the best action of the nurse? A. Insert an oral airway and administer oxygen. B. Call for anesthesia to immediately reintubate the patient. C. Remove the pillow from behind the patient's head. D. Elevate the head of the patient's bed. Answer. A. Insert an oral airway and administer oxygen. Rationale. The snoring sounds made by the patient and low oximetry levels indicate that the patient's airway is partially occluded due to the effects of anesthesia and pain medication. An oral airway should be inserted and oxygen administered to maintain the airway and oxygenation. Reintubation should be performed if the oral airway alone does not maintain the airway and improve oxygenation. Removing the pillow from the head of the patient's bed or elevating the head of the patient's bed will not be sufficient to open the patient's airway. The nurse is caring for a post-operative patient on his first day after surgery. The nurse informs the patient that the plan is to sit in the chair and ambulate in the hallway. The patient states that he is in pain, and he has no intention of getting out of bed. What is the nurse's best response? A. It's important to move around so you don't get a blood clot in your leg. B. Your doctor ordered that you are to get out of bed at least twice every day. C. I understand. You can rest in bed until tomorrow when the pain is better. D. I will call the doctor and let him know that you do not want to get up. Answer. A. It's important to move around so you don't get a blood clot in your leg. Rationale. The nurse should teach the patient why it is important to ambulate after surgery to prevent postoperative deep vein thrombosis, DVT, formation. Simply telling the patient that the physician-ordered ambulation is not sufficient. Allowing the patient to stay in bed will increase the risk of DVT. The nurse is walking a post-operative patient in the hallway when she notices a large red stain of fresh blood on the patient's gown over the abdominal incision. The patient states, I felt something just ripped open. What is the priority action of the nurse? A. Lift up the patient's gown and assess the incision. B. Assist the patient to the floor and call for assistance. C. Return the patient to bed and irrigate the wound with sterile saline. D. Check the patient's vital signs and pulse oximetry. Answer. B. Assist the patient to the floor and call for assistance. Rationale. The large red blood stain over the incision and feeling of ripping open most likely indicates that the patient's wound has dehisced or eviscerated. The nurse should immediately lower the patient to the floor to reduce tension on the wound. Patient modesty and privacy should be maintained. So the incision should be assessed once the patient is transported back to his room. Checking the patient's vital signs and pulse oximetry can be performed once the patient has been lowered to the floor. The nurse is caring for a patient who is about to have surgery. Which intervention will be included in the patient's care to meet the goals for risk for perioperative positioning injury (RT) immobilization during surgical procedure? A. Orient the patient to the OR environment and place the call light within reach. B. Watch for early signs of hypovolemia caused by patient's NPO status since midnight. C. Use therapeutic touch and guided imagery to allay patients' fears of surgery. D. Pat all bony prominences and avoid hyperextension of extremities. Answer. D. Pat all bony prominences and avoid hyperextension of extremities. Rationale. Risk for perioperative positioning injury is addressed by ensuring that the patient's skin and bony prominences are well padded during the surgery. In addition, hyperextension of extremities may lead to joint damage, so this should be avoided as well. The other interventions are appropriate for perioperative care but do not relate directly to the nursing diagnosis of positioning injury potential. The circulating nurse assesses tachycardia and hypotension in the client. Which interventions should the nurse implement? 1. Prepare cooling blankets and dantrolene sodium. 2. Request the defibrillator be brought into the OR. 3. Draw a PTT and prepare a heparin drip. 4. Obtain finger stick blood glucose immediately. Answer. 1. Prepare cooling blankets and dantrolene sodium. Rationale. Unexplained tachycardia, hypotension, and elevated temperature are signs of malignant hyperthermia, which is treated with cooling blankets and dantrolene sodium. A defibrillator would be needed if the client were in ventricular tachycardia or ventricular fibrillation. 3 would not be appropriate for malignant hyperthermia. 4 would be important if the client had diabetes. The 3-day postoperative client is reporting unrelieved pain at the incision site 1 hour after the administration of narcotic pain medication. Which action should the nurse implement first? 1. Check the MAR for another medication to administer. 2. Teach the client to use guided imagery to relieve the pain. 3. Assess the client for complications. 4. Elevate the head of the client's bed. Answer. 3. Assess the client for complications. Rationale. The first step of the nursing process is to assess pain. Unrelieved 3 days postoperative needs to be investigated. Option the first of may be an appropriate intervention, but unrelieved pain 3 days after the surgery may indicate a problem. The nurse should assess the client first. A client in pain is not ready to learn. If narcotic medication is not successful, something else may be occurring. Repositioning the client may or may not help, but the nurse should assess the client. The nurse is receiving a client from the post-anesthesia care unit, PACU. Which interventions should the nurse implement? Select all that apply. 1. Ambulate the client to the bathroom to void. 2. Take the client's vital signs to compare with PACU data. 3. Monitor all lines into and out of the client's body. 4. Assess the client's surgical site. 5. Push the client's PCA button to treat for pain during movement. Answer. 2. Take the client's vital signs to compare with PACU data. 3. Monitor all lines into and out of the client's body. 4. Assess the client's surgical site. Rationale. The nurse should assess the vital signs from PACU with the current vital signs to be sure that the client is stable. The nurse should assess the intravenous lines, indwelling catheters, and tubes upon receiving the client. The nurse must assess the surgical site for bleeding to know if the client is stable or not. The client should not be ambulated until the nurse has a chance to assess for the client's ability to ambulate safely. Only the client should push the PCA pumps button, otherwise, the client may receive an overdose of medication. The nurse is completing the preoperative checklist for the client scheduled for a laparoscopic cholecystectomy. The preoperative complete blood count, CBC, results are in the EHR. Which action should the nurse implement first? WBCs, 12.3 RBCs, 6.8 HGB, 14.4 HCT, 41.8 platelets, 168.1. Check off that the CBC report is in the EHR. 2. Notify the surgeon of the WBC. 3. Assess the client for dyspnea. 4. Teach the client to turn, cough, and deep breathe. Answer. 2. Notify the surgeon of the WBC. Rationale. The nurse should recognize the WBC count as high, possibly indicating a current infection. The HCP should be notified immediately, and surgery may be cancelled because a laparoscopic cholecystectomy is an elective procedure. The client may have any of a number of infections. The high WBC could indicate pneumonia, but it could indicate another type of infection. The client returned to the medical surgical unit at 1800 following a 2-hour surgery and 1 hour in the post-anesthesia care unit, PACU. The nurse is reviewing the client's intake and output at midnight. Which intervention should the nurse implement based on the recorded data? 0701-1500. Oral, 0 milliliters, intravenous, in OR, 1501 to 2300. Oral, 250 milliliters, intravenous, 750 milliliters, urine, 120 milliliters, 1. Immediately place an indwelling catheter in the client. 2. Assess the client's skin turgor in the abdominal area. 3. Recheck the client's urinary output in 2 hours. 4. Encourage the client to drink 500 milliliters of clear liquids. Answer. 3. Recheck the client's urinary output in 2 hours. Rationale. The nurse should wait and monitor the client before taking another action. The client has an IV running at 150 milliliters per hour. The client should be given a chance to produce urine before rushing to take another action. This client has been without food or water for several hours before the surgery, so the client needs fluid intake to urinate. Indwelling catheters carry with them the risk of a urinary tract infection. The nurse should continue to monitor the client's output before taking this action. Skin turgor should not be assessed for indicating a fluid volume deficit yet. The client received fluids during surgery and would have had an indwelling catheter to prevent incontinence during surgery. The client should be allowed to rest. It has been a long day of waiting for the surgery to take place and then having the surgery. Pushing liquids at midnight is not advised, considering the need for rest. The nurse is reviewing the pathology report of a client post-cervical neck node dissection. The HCP has explained the results of the biopsy to the client. Which should the nurse implement? Specimen and site. Excisional biopsy of cervical neck lymph nodes. Pathological finding. Lymph node number 1, 9 by 5 centimeters. Multinodularity nodes. Positive for Reed-Sternberg cells. Lymph node number 2, 4 by 4 centimeters. Consistent with finding in node number 1. Lymph node number 3, 3 by 2 centimeters. Consistent with finding in node number 1. Lymph node number 4. Findings consistent with Hodgkin's lymphoma stage 3-1. Allow the client the opportunity to discuss feelings about the results. 2. Assess the client's neck dissection dressing for bleeding. 3. Monitor the client's white blood cell count for elevation. 4. Call the pathology department to verify the report is correct. Answer. 1. Allow the client the opportunity to discuss feelings about the results. Rationale. The client will have been told about the cancer diagnosis. The nurse should allow the client to verbalize feelings. The nurse should routinely monitor any dressing, but assessing the dressing does not address the pathology report and its implications for the client. The report indicates a diagnosis of cancer, not infection. The pathology report is performed on the actual cells removed from the tissues. The report does not need to be verified. The client has undergone an abdominal perineal resection of the colon for colon cancer with a left lower quadrant colostomy. Which interventions should the nurse implement? Select all that apply. 1. Assess the stoma for color every 4 hours and PRN. 2. Encourage the client to turn, cough, and deep breathe every 2 hours. 3. Maintain the head of the bed 30 to 40 degrees elevated at all times. 4. Auscultate for bowel sounds every 4 hours. 5. Administer pain medication sparingly to prevent addiction. Answer. 1. Assess the stoma for color every 4 hours and PRN. 2. Encourage the client to turn, cough, and deep breathe every 2 hours. 4. Auscultate for bowel sounds every 4 hours. Rationale. The colostomy stoma should be assessed to determine circulation to the stoma at least every 4 hours. A purple or bluish purple indicates that the circulation to the stoma is impaired and is a medical emergency. This is an extensive surgery requiring the client to be under general anesthesia for several hours. Turning, coughing, and deep breathing exercises done at least every 2 hours helps to prevent pneumonia. The nurse should assess for bowel activity at regularly scheduled intervals. The client is not allowed to sit on the perineal area for several days and should be maintained in a side-lying position when possible. Pain medication is administered to control the client's pain. The nurse is concerned with client comfort, not addiction. Poorly controlled pain is more likely to result in drug-seeking behavior than adequately treated pain. The nurse is preparing a client for surgery with general anesthesia. Which medication should the nurse question administering? Diagnosis. Right inguinal hernia allergies. PCN, metoprolol 50 mg PO daily, cefazolin sodium 1000 mg IVPB on call to OR, EMLA cream topical before IV start, dabigatran etexylate 100 mg PO daily 1. Metoprolol PO. 2. Cefazolin sodium IVPB. 3. EMLA cream topical. 4. Dabigatran etexylate. Answer. 4. Dabigatran etexylate. Rationale. Dabigatran etexylate, Pradaxa, is an anticoagulant. The nurse would question this medication. The medication should have stopped 5 to 7 days preoperatively. The nurse would question this medication, and the surgery may have to be postponed because the client is receiving an anticoagulant. Even though metoprolol, Lipressor, is an oral medication, and the client is NPO, beta blocker medications are not held for surgery. They are administered with a sip of water. Beta blockers can cause rebound cardiac dysrhythmias if not administered as routinely taken. Beta blocker medications should be tapered off to avoid cardiac issues. The nurse would not question this medication. Cefazolin sodium, Ancef, an antibiotic medication, would be expected to be administered prophylactically to prevent infections postoperatively. This is a cephalosporin, not penicillin. The nurse would not question this medication. Some facilities apply EMLA topical cream before initiating the IV to decrease pain during the procedure. The nurse would not question this medication. The nurse clears the PCA pump and discovers the client has used only a small amount of medication during the shift. Which intervention should the nurse implement? 1. Determine why the client is not using the PCA pump. 2. Document the amount and take no action. 3. Document the client as not having pain in the EHR. 4. Contact the HCP and request oral medication. Answer. 1. Determine why the client is not using the PCA pump. Rationale. Assessing why the client is not using the medication is a priority, and then, based on the client's response, a plan of care can be determined. The fact a client is not using pain medication warrants the nurse to determine the cause so appropriate action can be taken. This may or may not be why the client is not using the PCA pump. The nurse must first determine why the client is not using pain medication. This may or may not be indicated. But until the nurse determines why the client is not taking the medication, this action should not be implemented. The nurse is conducting an interview with a 75-year-old client admitted with acute pain. Which question would have priority when assisting with pain management? 1. Have you ever had difficulty getting your pain controlled? 2. What types of surgery have you had in the last 10 years? 3. Have you ever been addicted to narcotics? 4. Do you have a list of your prescription medications? Answer. 1. Have you ever had difficulty getting your pain controlled? Rationale. The answer to this request would indicate if the client has had a negative experience that may influence the client's pain management. Previous surgeries would be pertinent information but not for pain management. Before asking this question, the nurse should have specific information to suspect drug use. Discussing the client's prescription medications is necessary, but asking for a list of medications will not address the client's pain management. Which nursing intervention is a priority for the client experiencing acute pain? 1. Assess the client's verbal and nonverbal behavior. 2. Wait for the client to request pain medication. 3. Administer the pain medication on a scheduled basis. 4. Teach the client to use only imagery every hour for the pain. Answer. 1. Assess the client's verbal and nonverbal behavior. Rationale. Assessing verbal and nonverbal cues is the priority intervention because pain is subjective. Some clients are hesitant to ask for medication or believe it is a sign of weakness to ask. There are times when pain medications are given on a routine basis. But it is not the best answer because assessment takes priority. Alternative therapies, such as imagery, are used in combination with medications, but they never replace medications. Which technique would be most appropriate for the nurse to implement when assessing a 4-year-old client in acute pain? 1. Use words a 4-year-old child can remember. 2. Explain the 0 to 10 pain scale to the child's parent. 3. Have the child point to the face which describes the pain. 4. Administer the medication every 4 hours. Answer. 3. Have the child point to the face which describes the pain. Rationale. The faces scale is the best way to assess pain in a 4-year-old child. The nurse should use words a 4-year-old child understands and remembers, but this is not the best way to assess pain. A 4-year-old child cannot be expected to use the numeric pain scale because of a lack of cognitive abilities, and explaining it to the parents does not address the child's pain. This does not assess the child's pain, and administering the pain medication every 4 hours may compromise the child's safety. The nurse is administering an opioid narcotic to the client. Which interventions should the nurse implement for client safety? Select all that apply. 1. Compare the hospital number on the MAR to the client's bracelet. 2. Have a witness verify the wasted portion of the narcotic. 3. Assess the client's vital signs before administration. 4. Determine if the client has any allergies to medications. 5. Clarify all pain medication orders with the healthcare provider. Answer. 1. Compare the hospital number on the MAR to the client's bracelet. 2. Have a witness verify the wasted portion of the narcotic. 4. Determine if the client has any allergies to medications. Rationale. This procedure ensures client safety by preventing the medication from being given to the wrong client. This is a legal requirement, not a safety issue. This intervention would prevent giving a narcotic to an unstable or compromised client. Determining allergies addresses client safety. It would not be realistic to recheck all orders. Which intervention is appropriate for the RN to delegate to UAP when caring for the female client experiencing acute pain? 1. Take the pain medication to the room. 2. Apply an ice pack to the site of pain. 3. Check on the client 30 minutes after she takes the pain medication. 4. Observe the client's ability to use the PCA. Answer. 2. Apply an ice pack to the site of pain. Rationale. Medication administration cannot be delegated to AUAP. This task does not require teaching, evaluating, or nursing judgment and therefore can be delegated. Assessment cannot be delegated to AUAP. Evaluation of teaching cannot be delegated to AUAP. Which nursing intervention is the highest priority when administering pain medication to a client experiencing acute pain? 1. Monitor the client's vital signs. 2. Verify the time of the last dose. 3. Check for the client's allergies. 4. Discuss the pain with the client. Answer. 4. Discuss the pain with the client. Rationale. The nurse should question the client to rule out complications and to determine which medication and amount would be most appropriate for the client. This is assessment. It is important to monitor vital signs, but it is not a priority intervention before administering the medication. The nurse should verify the time the last dose was administered to determine the time the next dose could be administered, but this is not the priority intervention. Before giving any medication, the nurse should assess any allergies, but it is not the priority intervention. Which situation is an example of the nurse fulfilling the role of client advocate? 1. The nurse brings the client pain medication when it is due. 2. The nurse collaborates with other disciplines during the care conference. 3. The nurse contacts the healthcare provider when pain relief is not obtained. 4. The nurse teaches the client to ask for medication before the pain gets to a 5. Answer. 3. The nurse contacts the healthcare provider when pain relief is not obtained. Rationale. When the nurse contacts the HCP about unrelieved pain, the nurse is speaking when the client cannot. Which is the definition of a client advocate? 1 exemplifies the role of provider of care, and it does not address client advocacy. Action 3 is addressing the role of collaborator. Action 4 is providing care to the client and does not address client advocacy. The nurse is caring for a client in acute pain as a result of surgery. Which intervention should the nurse implement? 1. Administer pain medication as soon as the time frame allows. 2. Use non-pharmacological methods to replace medications. 3. Use cryotherapy after heat therapy because it works faster. 4. Instruct family members to administer medication with the PCA. Answer. 1. Administer pain medication as soon as the time frame allows. Rationale. pain medications should be administered at the frequency ordered by the HCP, not just when the client requests them. Especially for acute pain. Non-pharmacological methods should never replace medications, but they should be used in combination to help keep the client comfortable. Cryotherapy, cold, is used immediately post-operative or post-injury. Heat applications are applied at a later time. Only clients should activate the PCA to prevent overdosing. Which criterion does the Aldrete scoring system measure in the postoperative client? Select all that apply. A. Eye opening. B. Respiration. C. Motor response. D. Oxygen saturation. E. Electrolyte balance. Answer. B. Respiration. C. Motor response. D. Oxygen saturation. Rationale. The Aldrete score measures respiration, oxygen saturation, consciousness, circulation, and activity of the client being assessed for preparation for discharge from the post-anesthesia unit. Eye opening is measured with the Glasgow Coma Scale. Electrolyte balance is not a part of the Aldrete score. Which postoperative assessment findings should the nurse immediately report to the surgeon? Select all that apply. A. Complaints of pain. B. Urine output 10 ml per hour. C. Oxygen saturation 88%. D. Prolonged unresponsiveness. E. Dressing saturated in 15 minutes. Answer. B. Urine output 10 ml per hour. C. Oxygen saturation 88%. D. Prolonged unresponsiveness. E. Dressing saturated in 15 minutes. Rationale. Findings that should be immediately reported to the surgeon or anesthesiologist include prolonged unresponsiveness, urine output less than 30 ml per hour, oxygen saturation less than 93%. And more than the expected amount of bleeding at the surgical site. Complaints of pain do not have to be immediately reported to the surgeon and should be treated per the surgeon's order. Which postoperative medication order should the nurse expect to implement while a client is in the post-anesthesia care unit? Select all that apply. A. Analgesic. B. Antibiotics. C. Antiemetic. D. Antihypertensive. E. Anesthesia reversal agent. Answer. A. Analgesic. C. Antiemetic. E. Anesthesia reversal agent. Rationale. Two types of medications typically are administered in the post-anesthesia phase. Pain medications and antiemetic medications. Pain medications assist in lowering the client's pain level and, in turn, decrease elevated blood pressure and pulse rate. Antiemetic medications assist in decreasing nausea and vomiting. An antihypertensive medication would only be given if a client's blood pressure was elevated and not responding to the effects of pain medication. An antibiotic would only be given if the client is expected to have an infection. Anesthesia reversal agents are typically given prior to the client leaving the operating suite if appropriate. Which postoperative assessment findings should indicate to the nurse a change in a client's cardiovascular status? Select all that apply. A. Absent gag reflex. B. Dropping blood pressure. C. Pedal pulse non-palpable. D. Capillary refill time greater than 3 seconds. E. Vomiting moderate amount of green emesis. Answer. B. Dropping blood pressure. C. Pedal pulse non-palpable. D. Capillary refill time greater than 3 seconds. Rationale. Changes in cardiovascular status affect blood pressure, pulses, and capillary refill. Dropping blood pressure, non-palpable pedal pulse, and capillary refill time greater than 3 seconds reflect a change in the cardiovascular status. An absent gag reflex indicates a change in a protective neurological reflex. Vomiting indicates a change in gastrointestinal status. The nurse identifies the postoperative client as being at an increased risk for impaired oxygenation. Which is the best collaborative intervention to address this client's problem? A. Medicating for pain. B. Providing antibiotics. C. Applying oxygen 2 liters by nasal cannula. D. Administering 1 unit of platelets. Answer. C. Applying oxygen 2 liters by nasal cannula. Rationale. For a client at risk of impaired oxygenation, applying oxygen 2 liters by nasal cannula would be the appropriate intervention to implement. Providing an antibiotic would be applicable if the client were at risk for an infection. Medicating for pain would address the problem of comfort. Providing platelets would be appropriate for perfusion or coagulation problems. Which information should the nurse identify as a part of intraoperative documentation? Select all that apply. A. Surgical counts. B. Systems assessment. C. Antibiotic infusion times. D. Total fluid intake and output. E. Start and stop times of anesthesia. Answer. A. Surgical counts. C. Antibiotic infusion times. D. Total fluid intake and output. E. Start and stop times of anesthesia. Rationale. Intraoperative documentation includes surgical counts, antibiotic infusion times, total fluid intake and output, and start and stop times of anesthesia. Medications administered and dressings applied are also included. Systems assessment as a part of the postoperative documentation. Which hand hygiene should the nurse perform before participating in client care during a surgical procedure? Select all that apply. A. Washing hands when the case is completed. B. Washing the gloves when saturated with blood. C. Washing hands when surgical gloves are removed. D. Completing a 5-minute surgical scrub after removing the gloves. E. Completing a surgical scrub before applying sterile gloves. Answer. A. Washing hands when the case is completed. C. Washing hands when surgical gloves are removed. E. Completing a surgical scrub before applying sterile gloves. Rationale. When preparing to participate in intraoperative client care, the nurse should complete a surgical hand scrub prior to applying sterile gloves. Once the case is completed, the nurse should wash their hands thoroughly. Hand washing is also necessary when surgical gloves are removed. The surgical gloves are never washed but may need to be replaced during the procedure. A surgical scrub is not necessary at the conclusion of a surgical procedure. The circulating nurse and the scrub technician ND a discrepancy in the sponge count. Which action should the circulating nurse take? RST. 1. Notify the client's surgeon. 2. Complete an occurrence report. 3. Contact the surgical manager. 4. Recount all sponges. Answer. 4. Recount all sponges. Rationale. A recount of sponges may lead to the discovery of the cause of the presumed error. Usually, it is just a miscount, or a result of a sponge being placed in a location other than the sterile field, such as the floor or a lower shelf. When discrepancies occur in the count, it is usually a simple mistake discovered with a recount. The surgeon will be notified if the count is wrong after a recount. If an error is found to have been made, an occurrence report will be completed, but it is not the first intervention. This would be done if a correct count is not maintained, but it is not the first intervention. The nurse is completing a preoperative assessment on a male client who states, "I am allergic to codeine." Which intervention should the nurse implement? RST. 1. Apply an allergy bracelet on the client's wrist. 2. Label the client's allergies on the front of the chart. 3. Ask the client what happens when he takes the codeine. 4. Document the allergy on the medication administration record. Answer. 3. Ask the client what happens when he takes the codeine. Rationale. The nurse should first assess the events that occurred when the client took this medication, because many clients think a side effect, such as nausea, is an allergic reaction. All other three options are important, but it is not the first intervention. The circulating nurse observes the surgical scrub technician remove a sponge from the edge of the sterile eld with a clamp and place the sponge and clamp in a designated area. Which action should the nurse implement? 1. Place the sponge back where it was. 2. Tell the technician not to waste supplies. 3. Do nothing because this is the correct procedure. 4. Take the sponge out of the room immediately. Answer. 3. Do nothing because this is the correct procedure. Rationale. The technician followed the correct procedure. Sponges are counted to maintain client safety. So all sponges must be kept together to repeat the count before the incision site is sutured. The sponge must be removed, not used, and placed in a designated area to be counted later. Items that are on the edge of the sterile field are considered contaminated and should be removed from the field. The technician is not wasting supplies. The technician is following principles of asepsis. Taking the contaminated sponge out of the room would cause a discrepancy in the sponge count. The nurse is caring for a client scheduled for total hip replacement. Which behavior indicates the need for further preoperative teaching? 1. The client uses the diaphragm and abdominal muscles to inhale through the nose and exhale through the mouth. 2. The client demonstrates dorsiflexion of the feet, Xing of the toes, and moves the feet in a circular motion. 3. The client uses the incentive spirometer and inhales slowly and deeply so the piston rises to the preset volume. 4. The client gets out of bed by lifting straight upright from the waist and then swings both legs along the side of the bed. Answer. 4. The client gets out of bed by lifting straight upright from the waist and then swings both legs along the side of the bed. Rationale. The correct way to get out of bed postoperatively is to roll onto the side, grasp the side rail to maneuver to the side, and then push up with one hand while swinging the legs over the side. The client needs further teaching. To perform deep breathing exercises and range of motion exercises are correct. Therefore, no further teaching is needed. Use a volume incentive spirometer correctly. Therefore, no further teaching is needed. The nurse is assessing a client in the day surgery unit who states, "I am really afraid of having this surgery. I'm afraid of what they will ND." Which statement would be the best therapeutic response by the nurse? 1. Don't worry about your surgery. It is safe. 2. Tell me why you're worried about your surgery. 3. Tell me about your fears of having this surgery. 4. I understand how you feel. Surgery is frightening. Answer. 3. Tell me about your fears of having this surgery. Rationale. This statement focuses on the emotion that the client identified and is therapeutic. This statement is giving false reassurance. Why is never therapeutic. The client does not owe the nurse an explanation. This statement belittles the client's fear. And no person understands how another person feels. The nurse must obtain surgical consent forms for the scheduled surgery. Which clients are able to consent legally to surgery? Select all that apply. 1. The 65-year-old client who cannot read or write. 2. The 30-year-old non-English speaking client. 3. The 16-year-old client with a fractured ankle. 4. The 80-year-old client not oriented to the day. 5. The 45-year-old client who is blind and cannot read Braille. Answer. 1. The 65-year-old client who cannot read or write. 2. The 30-year-old non-English speaking client. 4. The 80-year-old client not oriented to the day. 5. The 45-year-old client who is blind and cannot read Braille. Rationale. The 65-year-old client unable to read can mark an X on the form and is legally able to sign a surgical permit as long as the client understands the benefits, alternatives, and all potential complications of the surgery. The non-English speaking client can and should have information given and questions answered in the client's native language. A client is able to give permission unless determined incompetent. Not knowing the day of the week is not significant. The client who is blind can consent to surgery. The validity of the consent does not depend on if the form is verbal or written. It depends on voluntary consent and a complete understanding of the surgery by the client. A 16-year-old client is not legally able to give permission for surgery unless the adolescent has been given an emancipated status by a judge. This information was not given in the STEM. The nurse in the holding area of the surgery department is interviewing a client who requests to keep his religious medal on during surgery. Which intervention should the nurse implement? 1. Notify the surgeon about the client's request to wear the medal. 2. Tape the medal to the client and allow the client to wear the medal. 3. Request the family member take the medal prior to surgery. 4. Explain taking the medal to surgery is against the policy. Answer. 2. Tape the medal to the client and allow the client to wear the medal. Rationale. The medal should be taped, and the client should be allowed to wear the medal because meeting spiritual needs is essential to this client's care. The surgeon does not need to be notified of the client's request. This can be addressed by the nursing staff. The client should be allowed to bring the medal to surgery if the medal is taped to the client. Hospital policies should be established for the well-being of clients, and spiritual needs should be addressed. The nurse is preparing a client to receive electrosurgery. What priority nursing action should be implemented before this procedure is performed? Select all that apply. A. Maintaining strict aseptic technique. B. Completing a baseline skin assessment. C. Removing the client's jewelry and eyeglasses. D. Covering windows and reflective surfaces with a towel. E. Ensuring that tattoos, metal implants, and scars are not used for pad placement. Answer. C. Removing the client's jewelry and eyeglasses. E. Ensuring that tattoos, metal implants, and scars are not used for pad placement. Rationale. When using electrosurgery, the nurse needs to ensure that the pads are not placed over metal implants, tattoos, or scars, and that all jewelry and eyeglasses are removed from the client. Strict aseptic technique is needed when an immobilizing device is being placed through the client's skin. A baseline skin assessment is completed before using a pneumatic tourniquet. Covering windows and reflective surfaces is done when a laser is being used. The nurse is placing a client into the prone position for surgery. What is the most important action for the nurse to take? A. Placing pillows under the knees. B. Protecting the eyes. C. Protecting the feet on a padded footboard. D. Securing the arms on padded arm boards with palms up. Answer. B. Protecting the eyes. Rationale. When in the prone position, the eyes must be protected to prevent ocular injury. Pillows are placed under the knees in the supine position. Feet are protected on a padded footboard in the semi-fowler position. Arms are secured on padded arm boards with the palms up in the supine and semi-fowler position. Which consideration is a requirement for a surgical procedure that takes longer than 30 minutes to complete? A. The client has pillows placed under the knees. B. The client has an order for a blood transfusion during the procedure. C. The client is wearing sequential compression devices. D. The client is in the lithotomy position. Answer. C. The client is wearing sequential compression devices. Rationale. For procedures expected to last 30 minutes or longer, clients should wear sequential compression devices to reduce the risk of venous thromboembolism development from prolonged inactivity. The use of the lithotomy position does not determine the length of the surgical procedure. Placing pillows under the knees is a preventive action for the client in the supine position for a surgical procedure. Blood transfusions are not needed for all clients. The nurse is assessing a client preoperatively. Which finding should alert the nurse that the client is at risk for developing a surgical infection? Select all that apply. A. Body mass index of 33.7 B. Fasting blood glucose level of 258 mg per deciliter. C. Prescribed steroids for chronic lung disease. D. Takes acetaminophen daily for arthritis pain. E. Treated for gastric ulcers caused by H. pylori. Answer. A body mass index of 33.7 B. Fasting blood glucose level of 258 mg per deciliter. C. Prescribed steroids for chronic lung disease. Rationale. Clients with an increased body mass index, BMI, who have diabetes, or who take immunosuppressants are at a higher risk for acquiring a postoperative infection. Taking acetaminophen and having a history of H. pylori does not increase the risk for developing a postoperative infection. Which information should the nurse include in the preoperative pre-procedural verification process during the preoperative phase? Select all that apply. A. Correct surgical procedure. B. Location of drains. C. Development of complications. D. Antibiotic administered. E. Mark of surgical site by the surgeon. Answer. A. Correct surgical procedure. E. Mark of surgical site by the surgeon. Rationale. Information reviewed during the preoperative pre-procedural verification process during the preoperative phase includes, but is not limited to, the correct surgical procedure and the surgical site marked by the surgeon, the name of antibiotic administered as a part of the intraoperative pre-procedural handoff report. Drains and complications are a part of the postoperative pre-procedural handoff report. The nurse is preparing a client for a surgical procedure. Which priority action should the nurse include to reduce the client's risk of developing a postoperative complication? Select all that apply. A. Monitoring body temperature. B. Observing for muscle twitching. C. Monitoring urine concentration. D. Monitoring blood pressure and heart rate. E. Ensuring that aseptic technique is used for the procedure. Answer. A. Monitoring body temperature. D. Monitoring blood pressure and heart rate. E. Ensuring that aseptic technique is used for the procedure. Rationale. Open procedures place the client at a higher risk for blood loss, hypothermia, and surgical site infections, SSIs. The nurse should monitor body temperature, blood pressure, and heart rate and ensure that aseptic technique is used for the procedure. Urine concentration is used to monitor for hypernatremia and hypovolemia. Muscle twitching is associated with hyponatremia. The nurse assessed an 80-year-old client who is scheduled for surgery and becomes concerned that the client is at risk for a post-operative complication. Which assessment finding caused the nurse's concern? A. Practices deep breathing and coughing. B. Bowel sounds audible in all four quadrants. C. Wears an anti-embolism stockings. D. Skin friable over bony prominences. Answer. D. Skin friable over bony prominences. Rationale. Friable skin increases the older client's risk for developing pressure ulcers, which could be exacerbated during the surgical case. This is the information that the nurse should communicate to the intraoperative nurse. Wearing anti-embolism stockings prevents the development of venous thromboembolism. Audible bowel sounds indicate an intact gastrointestinal system. Practicing deep breathing and coughing helps prevent the development of post-operative respiratory complications. A 78-year-old client is scheduled for surgery. Which intervention should the nurse make a priority when planning this client's care? Select all that apply. A. Preventing infection. B. Promoting skin integrity. C. Ensuring adequate oral intake. D. Maximizing respiratory function. E. Maintaining a normal body temperature. Answer. A. Preventing infection. B. Promoting skin integrity. D. Maximizing respiratory function. E. Maintaining a normal body temperature. Rationale. Lifespan considerations for an older client having surgery include maintaining skin integrity, preventing surgical infections, preventing the development of pneumonia, and maintaining a normal body temperature. Oral intake is not a specific lifespan consideration for an older client having surgery. While preparing medications for a client scheduled for surgery, the nurse observes that medications are scheduled for 0800 hours, analyzes the medication vial, and reviews the client's armband. Which rite of medication administration is the nurse performing? Select all that apply. A. Right time. B. Right client. C. Right teaching. D. Right medication. E. Right assessment. Answer. A. Right time. B. Right client. D. Right medication. Rationale. The rites of medication administration include right time, right client, and right medication. Right teaching and right assessment are not considered a part of the basic rites of medication administration. A preoperative client asks if blood products will be used during the procedure. Which laboratory value should the nurse explain is used to determine the client's need for blood products? Select all that apply. A. Platelets. B. Hematocrit. C. Hemoglobin. D. Prothrombin time. E. Red blood cell count. Answer. A. Platelets. B. Hematocrit. C. Hemoglobin. E. Red blood cell count. Rationale. The diagnostic tests of platelets, hematocrit, hemoglobin, and red blood cell count are used to determine if a blood transfusion is needed during the surgical procedure. Prothrombin time is used to determine the client's risk for bleeding. The nurse is discussing the challenges when caring for a pediatric surgical client. Which is the biggest challenge that must be included? A. Reducing the risk of pneumonia. B. Preventing skin tears. C. Preventing hypothermia. D. Reducing the risk of venous thromboembolism. Answer. C. Preventing hypothermia. Rationale. For the pediatric client, temperature regulation may be the biggest challenge. Preventing skin tears due to fragile skin. Reducing the risk of pneumonia, and reducing the risk of venous thromboembolism due to inactivity or concerns for nursing care of the older client having a surgical procedure. The nurse measures the client's blood pressure, pulse, and capillary refill prior to sending the client to the operating room. Which concept related to perioperative care is the nurse implementing? A. Quality control. B. Perfusion. C. Infection control. D. Safety. Answer. B. Perfusion. Rationale. The concept of perfusion is related to perioperative care. Nurses must be aware of the client's hemodynamic status and understand the guidelines for perfusion. The client's hemodynamic status is measured through blood pressure, pulse, and capillary refill. Measuring blood pressure, pulse, and capillary refill does not directly support the concepts of safety, quality control, or infection control. Which problem would be most appropriate for the nurse to identify for the client experiencing acute pain? 1. Ineffective coping. 2. Potential for injury. 3. Alteration in comfort. 4. Altered sensory input. Answer. 3. Alteration in comfort. Rationale. Alteration in comfort is addressing the client's acute pain. This is a psychosocial problem, which is not appropriate for an acute physiological problem. A potential problem is not a priority for a client in acute pain. Altered sensory input does not address the client's acute physical pain. Which problem should the nurse identify as priority for client who is 1 day postoperative? 1. Potential for hemorrhaging. 2. Potential for injury. 3. Potential for UID volume excess. 4. Potential for infection. Answer. 1. Potential for hemorrhaging. Rationale. All clients undergoing surgery are at risk for hemorrhaging, which is the priority problem. The client is at risk for injury. But the priority problem the first day postoperative is hemorrhaging. A potential fluid imbalance would be for less fluid as a result of blood loss and decreased oral intake. It would not be for fluid volume excess. Infection would be a potential problem but not a priority over hemorrhaging on the first postoperative day. The charge nurse is making shift assignments. Which postoperative client should be assigned to the most experienced nurse? 1. The 4-year-old client who had a tonsillectomy and is able to swallow UIDS. 2. The 74-year-old client with a repair of the left hip who is unable to ambulate. 3. The 24-year-old client who had an uncomplicated appendectomy the previous day. 4. The 80-year-old client with small bowel obstruction and congestive heart failure. Answer. 4. The 80-year-old client with small bowel obstruction and congestive heart failure. Rationale. The client appears stable. Pediatric clients can become unstable quickly. But the most experienced nurse would not need to care for this client. A client diagnosed with a fractured hip will be ambulated by the physical therapist and this client is stable. So the most experienced nurse does not need to care for this client. A young client after an appendectomy would require routine postoperative care. An older client diagnosed with a chronic disease would be a complicated case, requiring the care of a more experienced nurse. The nurse and the UAP are working on the surgical unit. Which tasks can the RN delegate to the UAP? Select all that apply. 1. Take routine vital signs on clients. 2. Check the Jackson Pratt insertion site. 3. Hang the client's next IV bag. 4. Ensure the client obtains pain relief. 5. Reposition the client every 2 hours. Answer. 1. Take routine vital signs on clients. 5. Reposition the client every 2 hours. Rationale. Taking the vital signs of the stable client may be delegated to the UAP. Assessments cannot be delegated. Check is a word which means to assess. IVs cannot be hung by the UAP. This is considered administering a medication. Evaluating the client's pain relief is the responsibility of the RN. Repositioning a stable client every 2 hours may be delegated to the UAP. The surgical client's vital signs are T98F, P106, R24, and BP88/40. The client is awake and oriented times 3, and the skin is pale and damp. Which intervention should the nurse implement? RST. 1. Call the surgeon and report the vital signs. 2. Start an IV of D5RL with 20 MEq/kCl at 125 ml per hour. 3. Elevate the feet and lower the head. 4. Monitor the vital signs every 15 minutes. Answer. 3. Elevate the feet and lower the head. Rationale. These are the signs of hypovolemic shock. By lowering the head of the bed and raising the feet, the blood is shunted to the brain until volume-expanding fluids can be administered, which is the first intervention for a hemorrhaging client. The surgeon should be notified. But this is not the first action. The client must be cared for. The postoperative client had lactated ringers infused during surgery. The rate should be increased during hemorrhage, which the vital signs indicate is occurring, but potassium should not be added. When findings of shock are observed, the nurse will monitor the vital signs more frequently than every 15 minutes. Which assessment data indicate the postoperative client who had spinal anesthesia is suffering a complication of the anesthesia? 1. Loss of sensation at the lumbar, L5, dermatome. 2. Absence of the client's posterior tibial pulse. 3. The client has a respiratory rate of 8. 4. The blood pressure is within 20% of client's baseline. Answer. 3. The client has a respiratory rate of 8. Rationale. If the effects of the spinal anesthesia move up rather than down the spinal cord, respirations can be depressed and even blocked. Loss of sensation in the L5 dermatome is expected from spinal anesthesia. The absence of a posterior tibial pulse is indicative of a block in the blood supply. But it is not a complication of spinal anesthesia. Option 4 is an expected outcome and does not indicate a complication. The nurse is planning the care of the surgical client having conscious sedation. Which intervention has highest priority? 1. Assess the client's respiratory status. 2. Monitor the client's urinary output. 3. Take a 12-lead ECG prior to injection. 4. Attempt to keep the client focused. Answer. 1. Assess the client's respiratory status. Rationale. Assessing the respiratory rate, rhythm, and depth is the most important action. The nurse needs to monitor all systems. But monitoring the urine output would not be a priority over monitoring breathing. Monitoring the client's ECG is appropriate, but it is not a priority. The client needs to be relaxed, not focused. But this is not a priority over respiratory status.